Okay, great. Thank you. All right. So the only disclaimer I have for this talk is that the advice I'm giving is not universal. If your child has significant developmental delay or autism, some of the things that I'll be discussing may apply and some may not. So hopefully, if your child has developmental delay and autism, they're already receiving additional supports and services, including help with feeding and nutrition. And if they're not, I would strongly encourage you to mention your concerns to your pediatrician so they can help you get those started. So this is just a little bit about me. I don't want to spend too much time. I've been doing some version of this talk for about 10 years. This has always been one of my favorite topics. I have two kids. I've been in practice for over a decade. Um, this is a brief overview of the presentation. First, we're going to talk about why this topic. Then we're going to talk about how development and behavior tie together while on this topic. Then we'll focus on eating and nutrition, what to do if there are concerns, and then we'll have hopefully a little bit of time for a review and some questions. So for me, I think that the transition from feeding an infant to a toddler is probably one of the biggest transitions that parents deal with. And it's like the first time that your kid is expressing their own opinions and having preferences. And this is one of the reasons I love this topic so much is that as long as I'm aware of the situation, I/we as your pediatrician can do a lot to help you. Because it really is easy to fall into some traps that aren't impossible to undo later, but can be kind of hard to dig yourself out of. So there's definitely like a relationship between normal expected toddler behavior and toddler feeding. For the purposes of this talk, we're going to say that a toddler is probably starting around one. Some kids get there a little bit before one, and you might extend this range up to about 3 years old. There's plenty of funny memes if you want to Google them on toddlers, but I like this definition that a toddler is a small creature who's only hungry after you throw away the food they refuse to eat 80 times. And I'd say terrible twos and toddler kind of go hand in hand in my eye. So here's some developmental norms of toddlers that can really have a big impact on feeding behavior. A normal toddler is exploring separateness and autonomy, and they have opinions and preferences. And this is not to say that infants don't, but definitely you have a toddler when they start saying no, and when things they used to like, they don't like anymore. And it's really clear what they want and don't want. And, a toddler has very low expressive language skills. They know what they want, they just can't communicate it very easily. And this does lead to a lot of frustration. So, frustration tolerance is just the ability that we have to tolerate being frustrated before we have some sort of emotional or behavioral outburst. And toddlers have, not to say zero, but a number close to zero. Naturally, toddlers are hesitant to try new things. This is called neophobia. Naturally, toddlers can kind of limit food down to the same familiar foods. That's often called a food jag. And I would say that like toddlers are masters of testing limits. They love cause and effect. They love, okay, I'm going to throw this out there. And oh, okay, that happened. Interesting. I might try something else next time. Or, oh, that worked. I'm going to keep doing that again. And it may or may not be in your best interest to keep that behavior going. So basically, their normal developmental milestones can directly contribute to poor feeding and parental frustration. If you try to just use the same infant feeding strategies that you used previously, they're probably not going to work. There's an author, and I thought of bringing the book in. I have a dog-eared copy of this book that we're going to talk about, but Ellen Satter, who's one of the I don't want to say oldest, but maybe most revered voices in sort of like the relationship between parents and kids as it relates to feeding. She says that a healthy toddler is engaging and curious, energetic and recalcitrant. If you treat him or her like you did when he was an infant and simply accept and support his desires, you will fail him utterly. He needs reasonable and firm limits in order to feel secure. And I wholeheartedly believe in that statement. So behavior and nutrition are both important. So this is definitely not a talk on just give these foods to your baby. This is a talk on how behaviors and the feeding environment basically are maybe as important, in some cases more important than feeding the correct amount of food. And I understand, and we all understand as pediatricians that parental anxiety and concern for a toddler's nutrition is high. Infants will generally take what you give them, and when they don't, it can be very anxiety provoking. But one thing that just the backside or the back of the curtain sort of views from pediatricians is we don't see a lot of malnutrition. In fact, probably we see more obesity and or overnutrition in our practice than we do undernutrition. So if your pediatrician seems a little laid back around malnutrition, it just really has to do with the food environment in the US. It's heavily fortified with minerals and vitamins, very calorically dense foods. And so it's not to say we're not going to consider it, but it's not at the forefront of our thought process. So I have seen over the years, and one of the reasons I like giving this talk, where if a parent from a place of loving has started to be a little too concerned about how their kid is eating and the amounts that they are eating, that can lead to some behaviors that even if you ask them, they wouldn't be proud of. So that might be like holding a screen up and sneaking a spoon in on the side. Force feeding, not so much restraint feeding, but feeding well beyond a boundary that the child has set. And or the sort of like sleep feeding, like infants, it's very common for an infant to take a dream feed where you kind of top them off, but that's really something that should end at the end of the infant year, in the beginning of the toddler year. And there is another way, that's really what you're here for, but it's a long road and it kind of depends on how far down the wrong path you've gotten, but there's always a way back. All right, so Jeff, here's our first or our only poll. And the polling question is, I have used a phone or screen time to distract my child while I feed them. And it's just yes or no. So we have what, like 21 participants. So maybe once we get to like 10 answers or 15 answers, we can shut it down. Whatever you think, Jeff.
Will you confirm you can see that poll?
I don't see the poll at this time.
Let me relaunch it.
Okay, I see it now. Oh, I can't vote. My answer would be no, but temptation is very high. All right. I don't want to take too much time on this. Do you have the option to close it now? Okay, yay, great. So it's about 50-50. I'd say that's pretty consistent with the talks that I've given in the past. So all right, let me click my screen advance stopped here. Okay, here we go. All right, so the book that I was referring to earlier by Ellen Satter is called How to Get Your Kid to Eat But Not Too Much. It was published in 1987. I've looked at more recent publications than this book, and I still keep going back to this one, just because when you think about the relationships between children and their parents, even with the rise of technology, that hasn't changed too much. So she basically, her big thing is that there is a golden rule of feeding children, and she also calls it the division of responsibility. Parents, our job is we're responsible for what is presented to eat and the manner in which it is presented, and children are responsible for how much and even whether or not they eat. And clearly this does not hold true for breastfeeding infants. This is once a child can feed themselves. All right, so here's what we're responsible for. Obviously, we need to select and buy food. We need to make a schedule for meals and snacks. We need to make and present meals, food preparation. We need to ensure that the food's in a form the kid can handle. We need to make meal times pleasant and distraction-free, and modeling and enforcing standards of behavior. This is, I think, hard for some parents to accept, but ultimately, as a parent, we are not responsible for how much a child eats, whether they eat, or kind of maybe more disturbingly for some, how a kid's body turns out or what their growth chart looks like. But the good news is it's never too late to start working on feeding. Toddlers are fast learners, and if you adopt the right environment and boundaries, they will adapt. They're always going to challenge it. They're going to put up a fight because they're used to doing things a certain way, just like we are, and they like to test limits. But with time and consistency, we can see improvements. So here's how you implement the golden rule. The next few slides are going to be what's some actual tactics, right? So hopefully you've bought into the fact that we're not responsible for how much a kid eats, but we can certainly do a lot of things to support that they will feed themselves well. So unlike infants, where you're kind of using more of a as needed or as demanded feeding schedule, with toddlers, it is important to have a schedule. So generally, if you kind of take milk feeds out of the day, 3 meals and 2 snacks, depending on naps, maybe one snack. Trying to have a consistent schedule at consistent times every day. A toddler can adapt to that schedule and kind of get used to it. And then what we need to release ourselves from is that a toddler's not going to eat well at every meal or every day. And this is probably an important tip because, again, talking about how toddlers like to test boundaries. Let's say you just finished a meal and your toddler didn't eat very well, and you're cleaning up, and then the child goes over to the pantry and starts, pointing like knack, knack, knack. What you can do when you have a schedule is you can basically say, "Oh, hey, sorry, buddy, it looks like you missed the bus. The next mealtime is just like in 2 hours," and then you can try distraction, manage a tantrum, whatever it is. But if you give in to that, basically what's happened is you can expect the next meal for the kid to try the same thing. So um, this is probably like if you could take 1 or 2 slides away from this talk, I would make this one of the main ones. You feed a baby, but you eat with a toddler. There comes a time in feeding a child when they are going to start resist spoon feeding and wanting to do things for themselves. And this is a good thing. It can feel like it's a terrifying thing, but it is actually a good thing. It's when we think of our goal as parents, we're trying to set kids up for success and trying to teach them to do things for themselves. So eat with your toddler and make mealtime pleasant. Try not to force or trick or give pressure. Eat from each other's plates. Talk, share anecdotes, share stories. Give them time to observe you eating and offer them bites of your food. Toddlers can be very slow and very messy, but if they're exploring food, they're heading in the right direction. If a kid is picking it up and smashing it, picking it up and touching it, picking it up and throwing it on the ground, they're exploring food, and that is a part of food acceptance. But when things are basically clearly over, like a kid has either flipped the tray or their arms are in the air, you can call it at that point too. Um, I don't think I have a specific comment on this, but like if you've observed your toddler, if you want to get them interested in something, like don't hand it to them, hand it to the person next to them, and that creates a desire that's very high for them to basically take it. So set them up for success. So physical environment and sort of what you can do. I have a strong preference. This is not what I hear from every family, and it doesn't have to be like this, but I have a strong preference for children sitting at the table and not coming and going. I know for some families that works for them. But it's generally not considered best practice to have a kid wander over, take a bite, wander away, or to follow them around and feed them because we do have a risk for aspiration when really anybody's, but especially kids, are walking and chewing. And then obviously like downsize the size of your cups and utensils. And then this is the time, if your pediatrician hasn't already mentioned it, at the 1 year check, where you'd want to start weaning the use of a bottle and switching over to cups. So when a kid is eating, this is a risk factor for choking. And so stay with them when they're eating. We can't really just dump food on the tray and then go off and do more tasks and stuff. We really should be eating with them, or if not eating at the same time, just talking and conversing with them. And then obviously food needs to be a safe texture. Raw veggies, popcorn, nuts, and large pieces of meat should be avoided just because they are an aspiration risk. And then, you can experiment with how you prepare and cut the food, but strips or like French fry shape is easy for kids to grasp and sort of bring to their mouth and nibble. I think the first 1 or 2 times I did this talk, I put a sample diet on here. But when you look at it and you compare it to your day with a toddler, feel like all it does is cause anxiety. Like when you look at like, okay, some days your kid's gonna nail it. You might look and be like, oh, breakfast was oats and lunch was an omelet, and dinner was a soup. And some days your kids do that and more. And then other days your kids barely do anything. But so sample diets are out there, but don't expect your kid to eat well every meal. In general, portion size, you can start with about a quarter of an adult portion, but you can adjust up or down for sure. As far as vitamins go, really the only vitamin that a toddler needs is vitamin D. And we're talking specifically about kids in the Pacific Northwest here. And then if you have a purely vegan diet where there are no animal products, adding a B12 and multivitamin can be helpful as well. But most kids that are eating a typical American diet do not need a multivitamin, they just need vitamin D. All right, so you do not need to limit in any way your infant or your toddler's fat intake. And in fact, some sources will say that up to 50% of their diet can come from fat, and that's still okay. And the main reason for that is that fat is an important nutrient for brain development. And then some vitamins, like specifically A, D, E, and K, are carried around and stored in fat in the body and also in foods. So these are some examples of some relatively healthy high-fat foods like whole milk and full-fat yogurt and cheeses, oily fish if you eat meat, avocado, olive oil, clarified butter, or ghee. Those are all great choices. A toddler does not need nearly as much milk as an infant does. Many kids, even in their late infant year, they start drifting away from milk a bit and just eating food. And as long as they have a decent variety of foods in their diet, you're not going to get malnutrition. Any more than about 20 ounces of milk per day, I've found that a child can become constipated. It can certainly impact their appetite. The more milk they drink, especially overnight milk, which is a pattern that some parents will still fall into, either because the toddler demands it or they're doing it because of concerns for daytime nutrition. It can really impact the appetite the next day. And excessive milk consumption can lead to iron deficiency. All right, so this is hopefully maybe the other thing you can take away from the talk that's kind of a key point. Help your doctor understand your concerns. Like to be honest, as pediatricians, we have a lot going on in that visit, and we're doing our best to make it seem fun and smooth, but there's a lot going on in our minds. And so when we see a normal growth chart, it can be pretty easy to blow past feeding behaviors. Like, oh no, they're doing fine. See, the growth chart looks fine. But when you really ask 2 or 3 more questions, what I've found over the years is that some of the kids with the best feeding behaviors can have really growth charts that are low percentile, they're up, then they're down. And some of the worst eaters, meaning like they're getting the most parental assistance and they're not learning how to do things themselves, their growth charts look really good. And it's really our job as pediatricians to help you figure out if things are okay or not. But you may need to prompt us, or admit to something you're not super proud of. And then, so if I see a growth chart that is starting to look like what we call failure to thrive, where the height or the weight are decreasing by 2 to 3 percentile lines, not percentage points, but you've probably all seen the growth charts. As if the weight or height start drifting down more than 2 lines, you're going to see our medical brains kick in a little bit and just figure out, okay, are we doing okay? Like, is this a kid that just started walking, but they're super energetic? And so they had some baby fat and they're burning it off. That could be an okay situation. And but we are always, as physicians, thinking about could there be a medical problem at hand here? So these are things that are best determined by your child's pediatrician. We can, if we're starting to get concerned about a growth chart that's not looking good, we can do a nutrition referral, but even better is what's called feeding therapy, and I'm going to talk about that next. So usually these are things that we'll prescribe via a birth to 3 center like Kindering or Encompass, or depending on where you live, there are other providers. The feeding therapist does an assessment and then makes a treatment plan. And then oftentimes they have a nutritionist they can work with as well. So the assessment may occur more and more. I did this talk, during the pandemic as well, and those were almost always like just virtual. But more and more, there's therapists coming out to houses, observing the home food environment, and observing feeding, and then just trying different approaches. Usually they'll take a play-based approach, which is based on the principle of desensitization, where you're offering and food and that you'd like the child to eat or explore, and just see when they hit their limit with it. Is it even when it's on the table? Is it when it's in front of them? Will they pick it up? Will they not? Will they touch it to their mouth? And usually it's something like, let's say it's a peas or something like that. A child, progress would be considered, they go from just flinging the peas away to taking and smashing the peas. And then next week, they're maybe like touching it to their lips and then putting it in no thank you bin, which is usually right next to the table. And this is like a slow process, right? This is like watching hair grow. Week to week, it may not feel like you're making any progress, but over time, it really does help. And then what it does also is it sets the correct parameters for parents to follow throughout the week too, because you can't really expect to make progress just working with a therapist once a week if you're not also following their recommendations throughout the week. Okay, so we've got 4 or 5 minutes left, so I'm going to run through the review, and then we can see, Jeff, if we have any questions. So there is a strong relationship to development that can lead to picky or problematic toddler feeding. Toddlers require a completely different approach to feeding than infants, but it's not hopeless. If you are on the wrong track, you can readjust them. Things can get better. If it's overwhelming and you're not sure how to fix it, make sure your doctor's aware of that, and there are resources that are available. And then your pediatrician, in my opinion, is your biggest resource and ally. Okay, and then these are some resources. We'll do questions. I think I have one or two funny little things at the end here too. That one's, I would say, an example of a nice permissive approach to food exploration. So, okay, Jeff, that's it.
Excellent. We do have a couple questions that did come in. Thank you, Dr. Keeler. Our first question is, do you have any tips on how to get our 2-year-old to drink water? Ours refuses any water at all, and it doesn't matter if it's in a bottle, cup, or a sippy cup.
Mm-hmm. Yeah, I mean, it's there's certainly no magic solution to when, because you kind of need to, what I would need to know, if I were talking to you about this in the clinic, I would sort of try and get a sense for how strong their reaction is against it. For example, like if a kid is like seeing water and having a tantrum versus, taking a sip here and there. So I would meet them where they are with it. And then I would try and use like the desensitization tips that we talked about, where maybe you have them practice pouring water for you and allowing them to give you water. Or you let them basically play or drink water in a less traditional environment, like you're at a picnic or you're at a park and you're away from the dinner table. Or one of the best hacks I found is that because kids do observe other children pretty closely and generally want to join in and do what they're doing, is find a friend whose kid is really good at drinking water, or giving them somebody they can observe, and see if basically hanging out with that kid can bring your kid around.
Excellent, thank you. Our next question is, do you have any suggestions for plates, utensils, or cups that lead to better eating behavior?
I used to make a brand recommendation. Things have changed a lot. I think that generally, if you're looking for utensils, for example, kids tend to do better when the utensils are a little higher quality. So, like for example, like very cheap plastic or silicone now stuff, it doesn't, like when you're trying to poke food, it doesn't poke. And when you're trying to scoop food, the food just kind of, because of surface tension, just kind of runs off. So I would make sure you have like a proper metal tip. Most of a brand that's used to be a really good product, it may still be, is called Nook, where they have the metal's there, but it's all rounded edges. It's really small. The length of the metal for the fork is very short, so it's not like a child could stick it in the back of their throat or something like that. But I would say look for thicker handles, metal tips, and rounded edges. And then plates, it's interesting. Some of the kids, like you saw in that Smurf guy, the tray itself can be the feeding area. And sometimes that works really well to just put the food on the tray, to have a wash clean tray, because kids are messy. And very often, even if food's served on a plate or in a bowl, it's going to end up on the tray anyways. So
So I've got just a couple more I want to ask. So
yeah, sure, sure.
one participant asked, do you have any recommendations for vitamin D and vitamin B12?
Yeah,
Specifically,
so
what brand do you recommend?
yeah, brand wise, I would say that a brand that I feel comfortable with is D-Visol. And that's just a one that's been around forever, but more recently there have been other good brands like Nordic Naturals tends to be really good too. I'm sorry I didn't put the B12 dose in the talk because I'm less familiar with it. But certainly it's something that's easily Googleable, or you could ask your pediatrician at the next visit. They're liquid vitamins, obviously, and they're just given once a day. And if, unlike medical treatments, if you miss a day with a vitamin, you don't have to double up or sort of do anything different the next time.
Great. And I'm gonna combine, I think, three questions, which are our last, but all very similar. The questions tend to be around how do you recommend keeping our toddlers and even our older toddlers focused on eating when they get distracted, they're bored, they start to run around, play. Do you have any recommendations on how to keep them a little bit more focused?
Yeah, I mean, it's honestly, it's more about what not to do, which is your job isn't to entertain them or like read them a book or bring some toddlers can bring a toy to the table and it's not too disruptive. Certainly, I would not recommend the use of screen time. Unless, I mean, I've definitely met some families where there is a TV on and everyone's watching a program together. I think that's a different thing than sort of holding a phone up to a kid's face and side feeding them. Sometimes this just takes a lot of practice. And one thing that does work well for this is like just literally practicing time in the high chair away from mealtime, like where you during non-meal times, they're sitting in the high chair and you're reading them a book then, and you're giving them consistent praise, or if they're a little bit older, running a sticker chart, and you're just getting them used to that environment. Because if you're already off on the wander and feed or the come and go, just to plunk a kid down into the high chair is going to feel really foreign to them and they're going to get bored really fast. So if you practice just sitting and being in the high chair during a non-feeding time, and you can keep them entertained then or reward them then that can help too. But what I would say is like I think the root of that question is like who has the power, right? And I think that's really what it is with toddlers, is who has the power. And it may not feel like it, but you ultimately have the power. And what I would say is that if all the other things are going well, you're not feeding them outside of mealtime, you're not following around and feeding them, everyone else is at the table, you're feeding each other, your toddler will notice that and they will come to the table.